Good morning, everyone. This is Sunday, April 5th. Um, Going live this morning to discuss coronavirus and take any questions you might have. Coronavirus is still increasing across the U.S. Hopefully, it won't be too many weeks that I can start saying something different, but it is still increasing across the U.S. at this point. 311,000 cases and 8,400 deaths. Good morning, Nancy and Mitch. Thank you for signing on. So, this morning I wanted to discuss reasons for why some people are suffering from excess in mortality. There was a report from Reuters titled, "Why is New Orleans coronavirus death rate twice New York's? Obesity is a factor." So I thought we could discuss that. And just take any questions that people might have. So in the article, found that when they looked at New Orleans, about 97% of people had a pre-existing condition that died. Obesity contributed a lot to that. It is related to chronic cardiovascular diseases, to chronic metabolic diseases, and also, diabetes. So it's related to all that. So the excess mortality was felt to be due to these obesity-related illnesses. They said that New Orleans residents suffer from obesity, diabetes, and hypertension at rates higher than the national average, and it is clear that obesity-related conditions are playing a role in the deaths. It could be a warning sign for the U.S. at large, where chronic obesity is more common than in other developed countries. So Nancy has a question. Let me take that. Nancy says, "Our daughter was treated with oral steroids for a prolonged period of time as a baby. She's now 21. Is there any residual vulnerability from that early life treatment?" I don't think so, Nancy. That treatment from the steroids would be not expected to suppress her immune system at this point. So yes, I wouldn't be concerned about that. It's only if somebody is on chronic steroids that's suppressing their immune system now that there could be some increased risk, and they should take extra precautions. And Nancy also asks, is bar soap versus liquid soap, does it matter? No, it doesn't. Probably the most important thing if you're going to use soap is washing your hands for 20 seconds. I've seen it suggested that you sing happy birthday song to yourself, and that would get you about the right amount of time. But you can choose any song that you like. Just make sure you wash them for about 20 seconds. So let's see. Yes, so what links many of the excess risk in these conditions is underlying inflammation. And so addressing underlying inflammation is key to reducing risk. Morning, Cheryl Ann. Hope everything's okay with you. So yes, addressing underlying inflammation is key to addressing risk. So, there are a couple of components to this. How do people know if they have underlying inflammation? Well, with obesity, you can almost always presume that there is some underlying inflammation. Um, the adipose cells are biologically active. It used to be thought that they just were places where you stored fat and that they were inert, not really doing anything, just kind of a storage facility. But that's now known not to be true. They put out a lot of inflammatory cytokines, um, a lot of active products that increase inflammation. And we can see that in all the conditions that are associated with it, the diabetes, the cardiovascular disease. So, um, decreasing that inflammation from the adipose tissue is important. It's key to what's going on. It's like Cheryl Ann getting ready to lead Palm Sunday worship. That's awesome. Being via Zoom, so that's important. Being in community can help reduce stress, help us feel supported. So kudos to you for that, Cheryl Ann. And you know, give my regards to your community and take this message forward to them to reduce inflammation and to go on diets that will reduce that inflammation. Um, so, good morning, Copley. Hope I'm saying that right. Um, and so, yeah, so anything that addresses inflammation will help reduce risk overall. Um, if people are unsure if they have inflammation, certainly seeking the advice of your healthcare provider. We do it at Princeton Integrative Health. We do a pretty deep dive into inflammation. As many of you probably know, I'm particularly interested in vascular risk and reducing that. And a key part of that is assessing inflammation and reducing inflammation from its various sources. But what we can do now without any testing is to change our diets, as I mentioned to Cheryl Ann, change our diets to anti-inflammatory diets. This usually involves some pretty simple principles: reduce the amount of processed carbohydrates, reduce the amount of grains in your diet, um, and increase your phytonutrient intake. That is your plant and vegetable, you plant your vegetable and fruit intake. We usually recommend, 2 to 3 servings of fruit per day, and then 5 or 6 or more servings of vegetables to help reduce inflammation. And this, any disease that is where inflammation is at the base of it, which is, almost every disease, whether you're talking about arthritis, whether you're talking about cancer, whether you're talking about heart disease, whether you're talking about pulmonary disease, GI diseases. Some of the GI diseases tell you right out that it's inflammatory bowel disease. Um, you know, anything that you can reduce inflammation will be helpful. Now, for some of these diseases, such as inflammatory bowel disease, I think you need a little bit of special guidance because sometimes people have trouble processing certain foods when they have that. But for the other than that, and food sensitivities, a diet that is reduced in carbohydrates, reduced in dairy for a lot of people, um, I would say is anti-inflammatory. Um, you know, some people might say this tends towards keto, and it does somewhat. But the you're getting carbohydrates from the fruit, so it's not really a true keto diet. Um, so, but that anti-inflammatory diet can, rather rapidly start to decrease inflammation and help with immune system function. So, I recommend that diet strongly. And if you need help with that, we have dietary programs like our metabolic reset program that can help people with that. Um, and the nice thing about uh, that is that can all be done online, virtually. Get all the information, and you can do that without ever having to come into the office. Cheryl Ann is asking about steel cut oats. They are grains. Cheryl Ann, probably of the grains, that's probably one of the better ones. I would say that um, you have to make sure that they're the organic ones that are not contaminated with gluten. Um, they're certainly a much different grain than the oatmeal that you get from, um, you know, Quaker's instant oatmeal. There's a lot of fiber there, that kind of thing. Some people have trouble with oats, so I would just suggest say see how you feel. Um, you know, I would say on balance, if you're trying to lose weight, I would avoid still, oats, since they have a lot of carbohydrates. But if your goal is not weight loss and it's more just balancing your immune system, I would say that the steel cut oats would be okay to keep in. Again, just making sure you note if there's any if they make you feel bad in any way. So. Cole is sending healing thoughts to everyone, and I certainly um, second that, third that, fourth that. Healing thoughts. The other ways we can reduce inflammation is by working on our nervous system, our thoughts. You can do that however you want. Meditation, yoga, lots of online yoga courses, prayer. Prayer is very powerful for people to reduce stress, learn how to, how to cope with stress better. Um, that is certainly a time-tested method with thousands of years of um, ancient wisdom behind it. Um, Again, as I mentioned before, being in community can help us reduce stress. And even though we have to socially distance, we could be in community virtually, as in Cheryl Ann's just going to lead a Palm Sunday service. Um, I saw in, I think it was Brooklyn, where everybody was coming out of their houses and making sure they were 6 feet apart, but somebody was blasting the music and there was a community dance party. We can do certainly novel things like that to help keep the communities together. Um, so, and don't know who knows about blue zones. People heard of blue zones? Blue zones are that community where people typically live to over 100, and one of their factors, they're all over the world. They're in Japan, Italy, Southern California, Greece. One of the things that binds those communities together is literally their community ties. They they have a strong sense of community. There's a lot of eating together, that kind of thing. So those community bonds can help certainly with the stress in our lives. So um, let's see. So yes, we don't, I mean, I also want to give a shout out to all the people who are on the front lines, the people at the hospitals who are actively caring for these people. Um, you know, if we can offer them as much support as we can, prayers for them. I think it's important. They are certainly facing a severe amount of stress. Um, Other people also, though, kind of the secondary supply lines, all those people, certainly being kind to them, um, since they are, they don't know if they're being exposed or not, but they're there for us so that we can go get our food, so we can go, go to the pharmacies. You know, those people are worried, and we need to send our support to them. So, and if anybody who um, is predisposed to depression, being taking some more active forms of reaching out to them to make sure that they're okay. Certainly, isolation is increasing the stress on people who are feeling depressed. So, reaching out to hopefully help them out. Morning, Krista. So again, I'm going to wrap this up. Let me just say that here are the strategies. I'll just summarize for everybody. You know, um, I just mentioned things that we do to decrease our stress, meditation, yoga, whatever it is, reading a good book, prayer can be helpful. That helps our autonomic nervous system, and the autonomic nervous system helps to balance our immune system. Doing things that decrease our inflammation are important. And as I mentioned, in the future, if you want help with this, we take a deep dive into inflammation. And the most important thing we can do to decrease our inflammation is changing our diet to a less inflammatory diet. Um, Decreasing our processed carbohydrates, um, and increasing our vegetables especially, and our fruits. Um, Eating a very colorful diet. That's how you know you're getting all the phytonutrients. Eating the color of the rainbow um, is how we often describe it. And if you need help, Princeton Integrative Health Metabolic Reset can help with that. Um, and the other thing you can do is check out Jenna's Immune Support Group. It's got a lot of great tips and strategies there. So I would say that those are the things you can do in the near term. Um, and as I mentioned, changing your diet is something you can do today or tomorrow and start to influence your inflammation, your inflammatory cytokines, to reduce the risk of you um, having a cytokine storm. So um, that's what all those people who are dying, what they all have in common are these underlying conditions that cause inflammation, that results in a cytokine storm, um, which is an excess amount of inflammation, and it overwhelms the body. So all the things I mentioned above with stress reduction, diet, um, and you know certain supplements can help also, and you can find those on Jenna's Immune Support Group. If you have any questions, please do not hesitate to contact us. Be happy to help in any way that I can, and we can all get through this. We can help each other, and while we are socially distancing, please distance um, socially. Contact those people that you're not able to see, reach out, and provide support. All right. Thanks everyone for tuning in. Honor you for taking this time to hear me. And please tell your friends and family about us, Princeton Integrative Health, and if we can help in any way. And I will be doing my next scheduled Facebook Live next Sunday at 9 a.m. And if there anything else comes up during the week, that's we'll be posting it on the Princeton Integrative Health website or the Immune Support website. All right, everyone. Blessings and peace to all of you. Stay safe and be healthy. And might be another question. Nope, no other questions. Cheryl Ann, have a good service. And everyone take care. I'll see you next week.